So today I'm actually going to share with you some tips on how you can help with your adductor groin pain. So stay tuned right now. Hi, I'm Dr. Matt Bradbury, family corrective chiropractor here in Georgetown, Ontario, Canada. And today I actually want to talk about groin pain, adductor pain, the muscle on the inside of your thigh, share with you a little bit about the anatomy so you understand your body better, and of course, some things that you can do on your own. So if you have soreness, maybe post-training, or you've had an acute injury and you notice that discomfort through here, these are going to be some really simple ideas that you can put to use today to help build yourself back up. Of course, if you're just tuning in, don't forget to like our video. And if you've enjoyed our content, I've mentioned in the past, we got a big mission in terms of helping people understand their health, and it makes a big difference. I know you want to get more of this, so please take a moment to hit subscribe. So first we got to identify what we're actually working on. And you'll notice here on our diagram, we have those groin muscles that help pull your legs together, stabilize how you move. Some of them have a role in you actually bringing your leg back like this, and mainly though, they're going to help you bring your legs together and stabilize things. So I want to go over how you can help yourself today in this area, some tips, and of course, don't forget, we have our spine and our nervous system. When you look at the bony anatomy, what's actually happening is these muscles are helping to bring your legs in and aiding you in how you walk, and some hip extension just like that. And of course, don't forget, oftentimes, yes, you may have a groin strain, but what controls all those muscles? It's actually going to be the nerves. And as a family corrective chiropractor, the main thing we look for is any structural shifts in the spine. Your pelvis is going to be related to your hip, help optimize healing. And of course, your nerves are going to control your muscles, your organs. So we're going to be looking for any nerve irritation, which also may be a factor in how you're healing. So I want you to first of all consider this one test. I'm going to show you how you can actually test the possibility that you've actually strained your groin muscles. So you're actually going to take the affected side on my right here, and I'm going to place this leg to the back to stabilize. I'm going to be up on this elbow, and what I'm going to do is gently try to lift this leg off of the bench. And if this causes you any sort of discomfort and it's really tight and sore and that elicits the pain, then it's likely you may have irritated your groin muscles. Now what you can get for yourself is actually a foam roller just like this. You can start with a softer version. This is just a piece of ABS wrapped in hockey tape. But what I suggest is start with a piece of foam, and what you're going to do is work on the affected side, laying face down. And what you're going to do is actually work with your knee flexed. So your knee's going to be bent for this one, and I'm going to work on areas on the inside of my thigh, just like this. And you may find yourself really tender higher up as well as lower down. So I'd start right here. You can see I have the foam roller placed perpendicular to the length of my thigh. And I'm actually, when I find areas that are a little bit uncomfortable, I'll hang out, breathe. And remember, if there's a painful spot, you may work above and below that spot that's actually painful. And here, I'll hang out for 1 to 2 minutes, working back and forth. Now the second variation involves actually straightening my leg. So you can see here my affected leg is straightened, and I'm actually going to work the same areas up and down, but just at a different length of the muscle, with the leg being straightened in this variation. And again, I can work here. If I find a tender spot, I can breathe into it, hang out for 5 to 10 seconds, but I'm going to work for 1 to 2 minutes up and down the inside of that thigh. Now, as you start to build yourself up again, I want you to work on just lightly contracting the muscles. And what you're going to do is focus on 10 to 20% of the full force that you could use. So it's going to be very light, and what you're going to do is start by laying on your back. And with this, you're going to use the foam roller again, but what you're going to do is start with your knees bent, and you're just going to contract, squeeze for 5 seconds, and then relax. You can do 10 to 15 of those. And when you're lying here, you're going to be just like this. Foam roller is going to be between your legs. And again, I'm going to contract with 10 to 20% of my full force. Count to 5, 4, 3, 2, 1, and pause. That's 1 rep. I'm going to do 10 to 15 of those. Now, as you work to build yourself up, I'm actually going to change the length of the lever again. I'm going to come down here, and I'm going to put the foam roller between my calves. So I'm going to make myself work a little bit harder. Now what I'm going to do is the same thing. My legs are straight, but I'm going to do 10 to 15 reps with each rep being 5 seconds. I'm going to contract 5 and 4 and 3 and 2, 1, and pause. So you see I've started at the bent knee position and then I've progressed to the straight leg position for this one. Doing what we call an isometric contraction is a really great way just to help stimulate blood flow, get you used to using the muscle again, and help with the healing process. Now, as you progress a few weeks into building yourself up again, what I'm actually going to suggest is you get a towel just like this, and you're going to go into what we call just a quarter squat position like this. And what I want you to do is just slide out and come up. Slide out and come back up. Now you're being really gentle when you're doing this, but I'm going to focus on doing this for 8 to 10 reps and 2 sets. And again, the working leg or the affected side, the side that was challenged, is the side that slides out. And you're really focused on feeling the stretch right here and then coming back up, standing tall, and feeling that muscle contract. Again, driving blood to the area, helping it know what's going on again, laying down those fibers as you help the healing process, and kick-starting things so you can live full out again. Now, as you've progressed through the foam rolling, the isometric squeezing of the foam roller, and finally the towel slides, you're probably a few weeks into this by now. What you're going to continue doing, I like doing the towel slides, the concentric, eccentric, so shortening and lengthening the muscle. Now I'm actually going to have the affected side down in this position again. And just like that original test we did, what I want you to do is now do this for reps. So get used to using your leg and using your groin muscles. And all I'm doing is coming up, pausing, and back down. Coming up, pausing. And I'm going to do this for 10 to 15 reps again for 2 sets. So I come up, I pause for a second, and then back down. I shorten the muscle, and then I let it lengthen. So again, moving it through a range of motion, getting used to contracting again, and reconditioning that groin muscle. Now, as things start to become easier, the last thing I want you to progress to is actually just a body weight squat. And what you're going to do is squat down, ideally through a pain-free range of motion. When you get a little bit of discomfort, push yourself just a bit. But I want you to get used to squatting again and using those muscles and cueing your adductors to help stabilize your hips, your knees as you go through a range of motion and get into a squat again. So I'm going to show you just here. So just like this, shoulders back. And again, I'm thinking about dropping between my knees. So my knees are going to open up a little bit. I'm going to sit nice and tall and come down. And if you get some discomfort right there, push slightly past it, breathe, and then come back up. And you're going to work in that range of motion again. With this, I want you to work on squats 10 to 15 reps, so a similar rep scheme for 2 sets, working on developing and strengthening how you move so you can get blood flow to the area and help recondition your groin adductor muscles. As you've made your progressions through the isometric exercises, the towel slides, the leg lifts, what I want you to come to next is actually just the body weight squat. And you're going to work again in the 10 to 15 rep range, but what I want you to do is ideally by this point, you're well along your way in the healing process. And as you squat down, remember you're just loaded with body weight, I want you to get just to the slight point where maybe you have some discomfort, push a little bit, and then come back up. Squat down, and then come back up. So ideally you want to get it to the point where you're getting through a full range of motion again, but of course it would take some warm up, some blood flow to get things moving. And what you're going to do is just like this, and some simple cues I like to think about when I do the body weight squat: big toes down, knees open, shoulders back, and I'm actually going to squat down, so I'm thinking about sitting between my knees. And I'm going to sit down, the whole time thinking about keeping my big toe into the ground, and you can use your arms to help counterweight if you like. But again, going through a range of motion, learning how to use your adductors again through a functional range of motion. And of course, as you wrap up today, remember, it takes your small, consistent action to make a big difference as you go through the process. So start with the foam rolling, the isometrics, the shortening and lengthening of the muscle, the strength training, and before you know it, you're going to start building yourself up to the newer version of you. You're going to be that much more resilient and injury resistant. So consider that today, and of course, course, I have a big mission in terms of helping other people understand their health. And as I've mentioned earlier and in the past, I cannot simply do it alone. So if you enjoyed this, please take a moment to hit subscribe and like to our channel. It really makes a big difference in terms of helping people understand their health. They have to have good spine and nervous system health for better health, and more function equals more health. Hope you enjoyed today, and I'll talk to you soon. Bye for now.